And the other project, we like to look at, the partners in crime. So not just the leukemia cells by itself, but also what we call the tumor microenvironment or the bone marrow microenvironment. So we want to find out how the leukemia cells communicate with the surrounding cells. My name is Laurence Cheung. I'm an Associate Professor at Curtin University and a Research Lead at Curtin Medical Research Institute and the Kids Research Institute Australia in Perth, Western Australia. I'm a pharmacist by trade, so I finished my pharmacy degree at the School of Pharmacy at Curtin many years ago, and then I practiced as a pharmacist for 9 years, and then I decided to go back to do some more study and started my PhD degree. The reason I want to do medical research is because during my honors at the pharmacy course, I really enjoy medical research, and I had the opportunity to do some research in the cancer area. So after 9 years, I think I really want to go back to the medical research, particularly in cancer field. So I get in touch with my honors supervisor at that time, and he introduced me to my supervisor, Professor Ursula Key, who is an expertise in childhood leukemia research. So I was inspired by her work, and therefore I decided to start my PhD with her. And after my PhD, I continued doing work in her lab, and then now I co-lead the lab with a pediatric oncologist, continue doing research in childhood leukemia. We are focusing on trying to find a novel therapy for those children with high-risk leukemia, because leukemia is the most common cancer in children. While the success is great, majority of the children with childhood cancer have good survival. Still, there are some subgroups that are not doing really well, particularly, infants with leukemia. The survival is still under 50%. So we want to find a better treatment for those children or infants with childhood leukemia. There are a few research projects currently doing in our lab. One of them is to try to find novel therapy for infants with leukemia. So we use animal model testing novel therapy and see what therapy are good to kill the leukemia cells so that we can propose it for clinical trial studies. And the other project, we like to look at, the partners in crime. So not just the leukemia cells by itself, but also what we call the tumor microenvironment or the bone marrow microenvironment. So we want to find out how the leukemia cells communicate with the surrounding cells. By disrupting the communication, we hope we will be able to make the cancer cells less active or be able to eliminate the leukemia cells easier. Another study that we're working on is trying to find how to make the immunotherapy more effective in children. We know that children and adults have different immune system, and therefore by understanding how the immune system works in children, and we'll be able to come up with a better strategy in order to make the immunotherapy more effective for children. We collaborate closely with Children's Cancer Institute in Sydney. We developed animal model together, and we have done some drug screening study together in the past years. Another collaboration we have is with Regeneron Pharmaceuticals in America. So we obtain some of the antibodies from them, testing in our animal models in order to try to find an agent that can disrupt what we call the tumor microenvironment. It's great to have the support from a number of organizations. For example, we have received funding from Toby for Childhood Foundation, who have provided support for us to carry on our work. We also received funding from Cancer Council WA and also the WA government through the Future Health Research and Innovation Fund. Research is a challenging field. I want to make a difference. As a pharmacist, I want to make a difference to patients' outcome. As an educator, I want to make a difference to students' learning. As a researcher, I want to make a difference to patients' outcome. Especially, we want to find cure for childhood cancer. No children deserve to have such a terrible disease. I like to spend time with my family on the weekend. My daughter likes to stay at home, so we're happy to watch TV together. My son likes to play tennis, so I take him to different tournaments, and I used to hit with him, and we always have good time on the tennis court. And he was a ball kid at the United Cup last month, so I was a volunteer driver at the United Cup, so we have fun time at the RAC Arena watching tennis together. So I think in the end, apart from work, I think it's a great time that I can spend a valuable time with my family.